Okay, it's 9 o'clock. If you stand, please join me in saying the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, happy Monday. Anybody forgot to turn their clocks ahead? That whistle should have woke them up a second ago. I'd entertain a motion to approve the minutes of Monday, March 2nd, 2026 meeting as written.
I'll make that motion.
I'll second. Okay, so McCurry moved, Peterson seconded. Any discussion? All in favor say aye.
Aye.
Anybody opposed? Passes 4-0. We have noxious weed director provided us the 2025 annual noxious weed eradication progress report, which I don't know if you guys have. There is a copy of it here if you want to see it. It was in the Canva. Anyway. Since I find it again, it jumped around on me. Okay, I'd entertain a motion to, upon the recommendation of the noxious weed director, to approve and sign the 2025 annual noxious weed eradication progress report for Coffee County. I'll make that motion.
I'll second it.
Okay, Peterson moved, McCurry second. Any discussion? All in favor, say aye.
Aye.
Anybody opposed? Passes 4-0. And, I think we all get to sign this. I will sign it and send it around.
Something happened that it got minutes down there.
Oh, yeah.
Something weird happened here.
It jumped, but we're back to normal. Then last week we talked about the that deferred compensation plan through Capers and told to get a resolution ready for today. So we have resolution 2026-971 regarding that. So I would entertain a motion to approve resolution number 2026-971.
So moved.
A resolution authorizing a deferred compensation plan for the employees of Coffee County and authorize the chairman to sign the same. Harper moved.
Second.
Avendroth seconded. Any discussion?
I just want to tell you guys that we were one of 8 counties that were not on this. And I don't know how we haven't done it all these years.
And basically, it does not cost the county. I mean, it's an option to give the employees another chance to get some.
And they have lower fees than some of the other that are out there, So.
Awesome. I'm glad we'll be able to do this.
Yeah.
Any other discussion? All in favor, say aye.
Aye.
Anybody opposed? Passes 4-0.
And you just need to sign Mark, I think, on this one.
Okay.
I guess we should modify that just a little bit. We need to move to authorize and direct the chairman to sign and to approve. I didn't see that. I didn't know that this was only just you. This is their resolution that they require, so at the top I added.
Oh, okay.
To move to authorize the chairman to sign.
Okay, Yeah, so basically it just said, Barker moved to authorize and direct the chairman to sign and to approve resolution number 2026-971, a resolution authorizing a deferred compensation plan for the employees of Coffee County, and authorize the chairman to sign, saying, that was at the end, so.
Oh,
So we had it covered. We
okay.
had it
Do you
covered.
want me to take that out then, or leave it at the top? Just move to approve?
Yeah, I don't think you need to have that at the beginning. We have that at the end.
Okay, sorry, I didn't.
So we
No, I didn't.
we were good.
Okay.
Okay, next up, Lindsay.
Oh, yes, thank you.
All right.
Good morning.
Good morning.
I don't think you need these photos.
Thank you.
You're welcome. Okay, that house there you're looking at is 202 Senior in Waverly. There's a house fire there. The exterior photos don't look super horrible, but that's why I gave you that back one. It's everything that was inside of it.
It did a lot of damage.
Yeah, Steve was there. He could tell you how it was.
We were just fortunate to contain it as much as we did.
So that is owned by Terry Bradley, and he is wanting to get those landfill fees waived. He's not going to put anything else there. He owns, and I think maybe that front picture, potentially you can see, yeah, that building there. He owns that, and that he lives in that building. So that was just his rental house that he had. He's not planning on doing anything else there. So he was just like those landfill fees waived.
Is there any kind of insurance coverage for this?
Yes, he does have insurance on it. I have the insurance policy, and the bid that they are going with to do the demo. City of Waverly, I have never heard of this before, and I don't think it's a bad practice, but the City of Waverly requires the homeowner to give them $15,000 of their insurance
Retainer to make sure.
to make sure that the house gets torn down, and after the house gets torn down, then the city gives that money back to them. So I'm like, whoa, that's a cool practice, I guess. Like, I mean, it ensures it's getting done, but I've never heard of that before. But yeah, he does have insurance. He's not going to build back, even if he would have this, it wouldn't have covered the building back process of it.
Yeah, where they clean that lot up.
Yeah.
Okay, I would entertain a motion to waive landfill fees for structure owned by Terry Bradley located at 202 Senior Street in Waverly.
I make that motion. I'll second it.
McCurry moved, Avondross seconded. Any discussion? All in favor, say aye.
Aye.
Anybody opposed? That passes 4-0.
Thank you so much, guys. Have a
No,
good
thank
day.
you.
Have a great day.
You too.
Okay. That takes us 9:05.
Was that before? No, that was after.
9:05 appointment, Planning and Zoning Administrator Heidi Harris. We're gonna review RFPs for Coffee County Airport subdivision.
Good morning.
Morning.
So I'm gonna get you out of packet. I'm pretty good. How about yourself? Kind of enjoying our nice weather we're gonna have today though.
Yeah.
Hopefully it stays for a while. So I'm gonna hand you out the packet. I know that I had given it to Angie and she posted on your tablet.
Yeah,
Oh, I already gave them copies.
she had copies.
Sorry, I didn't know you were
That's
gonna
okay.
know that.
So I'll just give you my packet because I have the sample motion on top. So I did give to Wade. I haven't heard back if that's a good motion or not, but it's kind of what we used in the past, if you could decide to do approval, so.
Whoops.
Sorry.
My bad.
So, we sent out the RFP. We did 8 different companies. We heard back from half of them, which that's pretty reasonable. Of the 4 you see in front of you, we got one from Cornerstone Regional Surveying, Driggs Design Group PA, Abbott Land Survey, and then Garber. So of all of the RFPs we received, anybody could do the work. They all have qualifications, they've all done similar projects. The one that the group and I decided heavily to recommend to you guys today would be Driggs. The reason why we chose Driggs was because Driggs has actually done the Coffee County Airport project back on page, they show you that for, they don't have page numbers unfortunately in the proposal, but
They're the company that bought Geotech,
yes,
is that right?
yes. Mr. Drake bought Geotech, and Rosemary still operates under them as well as their surveyor, one of their surveyors. If you look at Appendix B, which would be about almost near the end, they did this project back in, I want to say 2013, 14-ish time frame. So they've actually done work out at the airport. They've done and found where the flight plans are, where you can build, all that good stuff. So that was why we were recommending them for you guys to accept their proposal. Are there any other questions for me?
When I was looking at that, I saw 3 of them were pretty much in the ballpark, same fee and everything,
Mm-hmm.
but that one was way high. Was there a reason, or?
The one on Garber, I thought it was Garber was probably the highest one.
I think it was Abbott.
Was Abbott. So, from what I can understand with Abbott is that they were building in other engineering costs, like if this is the only project they're going to do out there for us, then they built all those different costs into it, because if they weren't going to get the rest of the work, it wasn't going to be their time to come out here and do this little bit of the project for us, is what I understood from the surveyors that were on the team that our consultant talked to. So they built all those overhead costs into the project with
It's about
that.
10 times the cost of everything.
Yes.
Yeah, I think.
So,
Okay.
like I said, I have that, if you're ready, to make a motion, I do have a sample motion in front of you. That was first page, or we can go over the RFPs some more. You just let me know how you would like to proceed forward.
So this one was basically a cost of $8,200. Is that how I was reading that? Including the preliminary plating and final plat.
Yes, that's how I would interpret that too. And then also, if you did choose Driggs, they'd have everything done substantially by September of this year. So 6 months from now, potentially, you could have a plat for buildable sites out there, if we chose them as well. So yes, 8,200 would be that cost.
That's pretty significant compared to the first one.
I was wondering if we should build in or include the costs in with the motion.
Good. And then after the date, say not to exceed. Would that?
Yeah, not
that
to
be-
exceed
not to exceed.
$8,200.
Yeah. And then I didn't know where you wanted the funds to come from, so that's why the funds weren't put on there. So if I want to decide what fund, to pull it out of too.
Community Improvement Reserve?
So, You could either do, you could do that, or you could do general fund community improvement. It'll be in the general fund,
Right.
whichever one you want to do.
The general fund, community improvement. Any other discussion on that? I'd entertain a motion to, based on the recommendation of the county zoning and subdivision administrator and the approval as to form by the county attorney. He has approved it, hasn't he?
I gave it to him to look at.
To authorize and direct the county commissioners to sign the contract for services with Driggs Design Group, PA, to complete Coffee County's airport subdivision plat dated this 9th day of March and estimated to be substantially completed by September 2026, not to exceed $8,200, with the funds to come from the general fund community improvement contractual line item.
Make a motion. You move. Yeah.
Abendroth
I'll
moved.
second.
Do we need to,
McCray seconded.
do we need to have Wayne approve this first?
Not a contingent upon Wayne's
Yeah.
approval.
That's what I think would be all right. I
Wayne-
don't have a
Well,
problem doing it.
Yeah, that's what the, and approval as to form by the county attorney. It's in the motion.
Oh, and approval as to form,
Yeah, it's in the motion. Explain about that. So. Any other discussion? All in favor, say aye.
Aye.
Anybody opposed? Passes 4-0.
Perfect, thank you guys.
and you say that, sometime, the finish up date is somewhere in September,
That's what they were proposing in Driggs was.
sure.
But like that was about some of the other bidders, they also have similar rate.
Yeah.
So I figured I'd give you a little update on what planning board's doing with the zoning regulations, so I can also be transparent with that. So the public hearing is scheduled for March 25th. It'll be at 7 p.m. at that 4-H building.
I'm sorry, say that again.
March 25th at 7 o'clock at the 4-H building is where the public hearing will be held for the proposed zoning regulations. And today I plan to get them on the county website, so anybody can look at them on the site, or they can also come to my office during regular business hours, and they're more than welcome to come review them as well.
And what time?
7 o'clock, so that'll start. And then a little update on the comprehensive plan. The company has it almost written, and so the plan would be for the planning board to review it, so they'll start reviewing it at their April meeting, and so that's the update on that as well.
It did.
So,
And the comp plan, that was originally planned to be substantially complete by
In
September.
September,
Okay.
which we may have to extend that based upon how the work sessions go and how fast our board can review it and kind of sign off on it before the public hearing, because it'll be, so the way it works is the planning board has to sign off on it to make a recommendation to you guys to agree to the plan, and then you guys make it a final document like the zoning regulations.
All right. Very good.
Thanks guys, hope you have a good day.
Thank you. Have a good work, David. Okay, 9:20, Health Department Administrator Amelia Marshall.
Good morning, Commissioner.
Good morning.
How are you guys?
Good, how are you?
Pretty good. I do have a couple of items just to go over prior to the grant information.
Thank you.
You're welcome. The second page is the grant information.
Okay.
So first up,
We had our campus immunization program audit last week. Overall, we received no deficiencies and we remain compliant with our VFC and our private and public vaccine program. Campus immunization program is addressing borrowing from private stock versus public stock statewide, so I did update our policy on that. The flyer that I handed out, if you guys remember last year around this time, they were going to do, KDHE was going to do a commissioner roadshow just to give some information on public health, and it required travel. So they did not have very much interest in that, just because it did require to travel. So they are offering Pulse of Public Health. So this is a 3-part virtual training series that is designed to help county leaders confidently fill their roles as the Board of Health. They are 30-minute sessions, and they start at noon. The first session is in April. These can be watched live, or they can be, they're going to be recorded so you can watch at a later date if those dates don't work for you guys. Session 1 is just about the value of public health. Session 2 is about the local boards of health and what is your role. And session 3 is about public funding, public health funding. Do you guys have any questions on any of that? It's just a resource that KDHE put together. If you guys are interested in attending, attend. If not, it's all good. All right. You're welcome. So next up, I do have the state fiscal year 27 grant to cover. So if we can recommend moving into Board of
Okay.
Health.
I would entertain a motion to recess as a Board of County Commissioners and convene as Coffee County Board of Health at 9:23 a.m. to discuss state fiscal year 2027 grant application and sign approval.
So moved.
I'll second.
Okay, Barker moved and McCurry seconded. Any further discussion? I said 9:23 and the clock's 9:22, and I was hoping it would change, so. But, all in favor, say aye.
Aye.
Anybody opposed? Passes 4-0. Just wait a few seconds.
It's a long minute.
My bad.
Okay, there it is.
There, it's
All right.
9:23. Okay.
Okay, so I'll do a recap of our current active grants because some of the grants that I'm gonna present for 2027 are kind of grouped in with this. So our current active grants, we have the SFY 26 KDHE Fall Prevention Mini Grant. So that's a $3,500 grant. So this is going to cover Matter of Balance, which is an evidence-based program designed to reduce fear of falling and improve activity levels among older adults. The program will consist of 8 sessions, 2 times a week. They're an hour each, and they will be delivered in small groups, 8 to 12 participants. The classes are going to be led by 2 trained coaches, and our coaches are Lindsay Beyer and Jennifer Huguenin. So the grant justification, budget justification for that one, there's some participant incentives, so medication organizer for those who attend, and adjustable dumbbells for strength training, educational materials, and then this will also cover the employee salaries to attend training to become Matter of Balance coaches, and our coaches did successfully complete those classes. So we will start offering those classes April of this year. And then another mini grant that we currently have is SFY 26 KDHE Injury Prevention Grant. This one is to be used within Safe Sleep Community Baby Shower. So it's an event that we host every year. It's $2,000. Safe Sleep Community Baby Shower is an event scheduled in April of this year for patients and caregivers who are expecting or have infants 18 months or younger. So this doesn't just include parents, it includes any caregivers. So whether it's daycare providers, grandparents, aunts, uncles, friends, they're more than welcome to attend. We have over 20 community resource partners to provide education and community connectedness. to address various topics such as motor vehicle crash, traumatic brain injury prevention, maternal mental health, safe sleep, poison prevention, home safety, and community resources and events. So that would include like parents as teachers or jump starts or like the events that the library puts on. We'll have our certified lactation consultant there, our certified safe sleep instructor there as well, and our certified car seat technician. Participant incentives, which is all covered by grants, include safe sleep items such as pack and play, sleep sacks and swaddles, nursing support items, pumping support items, and much more. I'm going to skip over the state formula, family planning, immunization action plan, maternal child health, because we'll go into our applications that we're applying for those. Another active grant that we have is our public health infrastructure. So this is a multi-year grant. We were awarded a couple of years ago $74,000. We have about $70,000 remaining in that, but we are going to be using the majority of that this year. The purpose of this grant is just to provide support for core infrastructure improvements such as local health department workforce and retention, foundational capabilities, and state infrastructure. Provide employee education opportunities, bonus incentives, wage increases, student loan repayment, tuition assistance, and more. So pretty much to help retain public health and help recruit as well. Okay, so going into the SFY 27 grant. So our first one is our state formula. So this is a pretty straightforward one. I just have to fill out a survey. It's about 100 questions. It's about local public health and county health. So the budget justification for this one is employee salaries. So it's pretty much just to help supplement the salaries for the health department. And that one is, I don't remember if I told you the amount, is $15,028. And then the family planning one, so the request is $11,977.77 with a match of $11,977.77. With this grant, the match has to be greater than 40%, so I just match it 50%. So this is a Title X family planning program that provides information and means to exercise personal choice in determining the number and spacing of their children, and provides access to additional health services such as well woman and well male exams. This is open to all individuals, but we do prioritize low income and high risk individuals. We host family planning clinics in the evenings from 5 to 7 every 2 months. And our providers for that is they're Ashley Buying or Dr. Sawyer. So the budget justification for this one is employee salaries, contract employees, so that would be our nurse practitioner and our pharmacist. We have to have a pharmacist on perform audits on a routine basis and just oversee our medication management, because we do distribute STI, STD medications and injectable and oral contraceptives. This also covers supplies and educational materials for our puberty and hygiene talks and sex education presentations that we provide to all of the school districts here within Coffee County. Pregnancy tests, urine analysis, feminine and male hygiene products, oral injectable and emergency contraceptives, and registration fees for the Governor's Public Health Conference for one employee, and that includes food, lodging, and travel fees, which attendance to that is required for us to be able to obtain this grant. The next one is the immunization action plan. So the request is $3,761 with a match of $3,761. So the purpose of this grant is to increase vaccination coverage, strengthen confidence in vaccines, ensure reliable access to immunization services for the community. The work plan focuses on reducing gaps in vaccination coverage by prioritizing populations with low immunization rates and protecting individuals of all ages from vaccine-preventable diseases. And the budget justification for this one is salaries. So this will cover for fiscal and progress report reporting and a portion of our nurses to provide the injections. Next one is the maternal child health. So the request for this one is $10,485 with a match of $10,485. This is a Title V maternal child health program that focuses on improving the health and well-being of mothers, infants, children, and youth, including those with special health care needs and their families. Priorities include women maternal mental health, perinatal and infant health, child health, and cross-cutting family consumer partnership. So providing community resources and services for healthy relationships and family well-being. The budget justification for this one is employee salaries, the community, baby shower supplies, car seat safety items, and the Governor's Public Health Conference registration and travel fees. So includes food, lodging, and travel. This is also a requirement for this grant. We also have SMART goals for this one, and we have 3 of those. The next one is the SFY 27 Public Health Emergency Preparedness Grant. This request is $8,818 with a match of $8,818. So this program is to help ensure the community and health system is prepared to prevent, respond, and recover from major health threats, to protect the community's health, and reduce harm during emergencies. And the budget justification for this one is employee salaries. And that is all. So, total of 5 grants that we will be applying for.
Okay, and you're seeking a motion
For approval.
to approve. I had Angie prepare a motion, see if this will
Okay.
work.
And to sign the grant application signature page.
Okay. See if this will work. Move to approve the state fiscal year 2027 grant application with the State of Kansas Department of Health and Environment for the grant period July 1, 2026 through June 30th, 2027 in the total amount of $50,069.77 and authorize and direct the chairman to sign the same. Does that sound like it'll work?
I'm gonna have 2, 1 for you and then 1
Okay.
for me to keep.
Okay.
I'll make that motion.
I'll second it.
Okay, McCurry moved, Avondra seconded. Any discussion on that motion? All in favor, say aye. Anybody opposed? Passes 4-0.
Amelia, how long does it take before you guys are normally notified whether you get it or not?
So it depends. So last year with the federal shutdown with the grant the grant funds, some of our funds we were notified June, July, and then some of them, like our public health emergency preparedness fund, we weren't notified until I believe September. And then with that, we also received some admitted funding with the STEP one, as well as the family planning, and so that was another adjustment after the first of the year. So,
Sounds like it's pretty quick.
yeah, as long as everything goes according to plan, we typically find out in June or July, but there's the potential for the delays. Do you guys have any other questions for us?
They're out there.
Is that all we need to do as a Board of Health?
Yes.
Okay, I would move to adjourn as a Coffee County Board of Health at 9:34 a.m. and reconvene as a Board of County Commissioners. I made the motion.
I'll second.
McCurry second. Any discussion? All in favor, say aye.
Aye.
Okay, opposed? Passes 4-0.
All right, well, that's all I have for today. I will probably be back here in a couple of weeks.
Okay, can't wait.
All right, thank you.
Have a great day.
You too.
All right. Got you a little bit ahead of schedule. You have all your crew here, or you? Oh.
No.
This is just folk that came in.
So is that everybody you're expecting?
Yeah.
Okay, we might go ahead and have you start a little bit early then.
Absolutely.
All right.
Thanks for making time for us this morning. I think everybody is familiar faces at this point except for Suzanne Garcia. I wanted to introduce her. She is our Chief Nursing Officer at the hospital.
She is working on completing her master's degree, so she's doing some clinical hours with me, so anytime there's an opportunity to expose her to new things, I like to bring her along, so she's just here serving today with us. I have a couple of updates that I wanted to provide you with. We'll also dive into the 2025 financials. Ray will go over that with all of you. The first thing that I wanted to notify you of is we had a recent opportunity. Reuters, if you're familiar with them, they're a news agency, if you will. Some people pronounce it Reuters. I think it's pronounced Reuters. Is it Reuters? Okay, perfect. They reached out to the Kansas Hospital Association. They're working on a piece regarding the challenges with rural health. And they saw Kansas, and of course, a lot of our rural hospitals are struggling. We all know that. So they were very interested in focusing on Kansas. They spoke with the Kansas Hospital Association, and it sounds like they were really focused on our hospitals going to start closing because of all these funding cuts that we're going to see coming down the line. And KHA did a nice job of kind of rerouting them of, you know, we might see some hospitals close, but the more likely scenario is we'll see hospitals decreasing service lines, making some difficult decisions, and maybe that's the route that they should take with this piece. And so that's kind of the avenue that they've went. KHA provided them with several hospitals throughout the state of Kansas that would be a good example of maybe who's had to make some difficult choices, but would also represent Kansas well. Coffee Health System was one of those, and so Reuters did come down and did an interview on site with us. They did some video with several folks in our organization. The primary focus of it was the closure of OB, which is no surprise. You know, at any point during the interview, everybody did a nice job of making it as positive as possible. You know, with this closure, it does hopefully make us sustainable for the future. And then also talking about while we no longer deliver babies, we still have avenues for people to receive prenatal care and those types of things. So we don't know when that news piece is going to be coming out, but I anticipate probably in the next several weeks, so I just wanted to make you all aware of it so that you're not surprised when you see that coming forward in the news. I also wanted to provide an update on general surgery services and our shared service agreement. So far that's going very well. Dr. Landry is our general surgeon that is providing services 1 day a week currently on Mondays. His schedule has been full the last several weeks, so we are quickly looking to increase that to 2 days per week. So the plan has always been to do 2 days, but anytime you start something new, you kind of want to start small until you get to a point that you can justify that additional day. So we'll be looking to do that in the near future. So far, everything has went very well. He's well received by staff, well received by patients. We've had good outcomes. He's just very personable, a great guy to work with. And one of the benefits of this agreement, we have had a few patients now that we have had at Coffee County Hospital to do procedures on because their insurance wasn't in network with Newman Regional. So that's kind of been a nice benefit. We all know that insurance is a bit of a game, and so this benefits the patients as well as the organization as well. And then we can, of course, reciprocate that with Newman's. If for some reason there's an insurance that we're not in network with, but Newman Regional is, they could still go ahead, see the general surgeon with us, and then go ahead and have their procedure done there. So we're just kind of exchanging those services back and forth. We are going to be having a board retreat on March 30th. It will be an all-day event. We'll start with doing our normal regularly scheduled board meeting, followed by a couple of presenters from KHA, and then we'll be doing some strategic planning as well on the 30th. And then I wanted to dive a little bit into the Rural Health Transformation Program. I've spoke with you all about that a couple times before, and each time I've come, I've said, we don't have a lot of details, we don't have a lot of details. I have some more details now, not as much as I would like, but I do have a little bit additional to share. So as we know, Kansas was awarded $221 million, which is $21 million additional on top of what the original application was for. So with that, the state had to rework the budget, rework their plan, and submit it back to CMS for approval. They did receive approval on that updated budget at the end of February, and so we're starting to see some of his initiatives move forward pretty quickly. Governor Kelly did appoint, it's a group of folks, the Rural Health Alliance is what they're called, and they're truly the steering committee for all of these funds and all of these initiatives, so everything is driving through them. They do have frequent meetings. They are available publicly on YouTube, so you're able to go out and watch those if you'd like. They are pretty lengthy, and you can rest assured that I am watching those and taking all that information away from them. The last one, it became very clear that there are 3 initiatives that are the primary focus or the highest priority that they're working on currently. So just to quickly cover those, the first one is the evidence-based practice program. This is an initiative that Coffee Health System will be involved in. Essentially what it is the hospital and all of our rural health clinics will have quality metrics that we have to report on to this group, and then in return they do give us direct funding, which is nice, because we all know these dollars are not intended to specifically necessarily come directly to hospitals, and this is an initiative where we could receive some funding from that. The purpose of this initiative is to start getting these small hospitals more towards a value-based care model. By 2030, we'll be required to be in some sort of a value-based care program, and this is an initiative to kind of help us take some of those steps towards that direction, while also receiving some of that funding as well. They will release more details and the contracts on April 1st, so I'll be able to share more details once we receive that. The second initiative is the Anchor Hospital Advancement Program. So they have named 10 anchor hospitals throughout the state. They're all smaller in size. They're not large tertiary facilities, but they are larger than what Coffee Health System would be. The objective of this program is to keep care close to home by elevating identified anchor hospitals' ability to provide specialty care and support to rural health systems in their region. So the goal when they named the 10 different hospitals, when you look at them, if you map them out on the state, all of them are spread out, and the goal was to have an anchor hospital within 60 minutes of every rural hospital. Our anchor hospital is Newman Regional. They were named as one. Don't have a whole lot of details on exactly what that means for those anchor hospitals. They have said the categories that they're looking at as far as putting some funding into for these anchor hospitals is consultative resources. I understand that to be more of administrative or IT support. AI and EHR optimization, which I'm excited about this one because, as you know, we do share an EMR system with Newman Regional. So if they receive funding to do some things in their network, we potentially could benefit from that because we are on a shared system. Remote patient monitoring and then rural residency programs are the other items they have listed underneath of that initiative. And then the last initiative is 2 grant opportunities. The first one is a rural emergency hospital conversion. So there's a new designation out there called rural emergency hospital. We are not at all interested in that type of a conversion. It could be very positive for some facilities depending on where they're at. For Coffee Health System, I don't see the benefit in that. We would lose our 340B program. We wouldn't be able to have swing bed patients. You aren't able to have inpatients any longer. But there is some favorable reimbursement for that. But for our situation currently, that would not be something that I would be interested in or would encourage our board to move that way.
Because if you did, you would lose your swing bed.
We would, and we'd lose our 340B funding and an inpatient status as well. You can only have observation patients at that point. So the second grant opportunity is a regional partnership grant program. They plan to award 5 to 10 of these throughout the state, ranging from anywhere from $2 million to $10 million. There are several folks that are working on applications. Letters of intent are actually due today. They're not required, but they're highly encouraged. And then you have a couple of weeks to actually work on those applications. So I am working with a few folks on a couple of different applications on that. But the big push with this particular grant is clinically integrated networks. So I wanted to provide a little bit of education on what clinically integrated networks are and kind of what Coffee Health System is moving towards with that.
Thank you.
So a clinically integrated network, in the simplest terms possible, is essentially multiple hospitals working together as a group. It is truly what it is. I mentioned it did a lot of discussion at our last board meeting on clinically integrated networks. One of our board members chimed in and said, "Oh, it sounds exactly like a cooperative, like a co-op," and that's honestly the perfect way to describe it. Everybody that is in a clinically integrated network remains completely independent of one another, but you are collaborating with one another to essentially strengthen your organization. So healthcare, especially in Kansas, is moving towards CINs for rural health because we are seeing a shift from paying providers based on just the services they provide to more of a value-based care model, meaning we will be paid based off of patient care and outcomes. This model allows us to have the numbers and resources needed in order to participate. And again, we do have to be participating in a value-based care program by 2030. So by joining a CIN, participating providers, they agree to coordinate patient care between hospitals, clinics, and specialists. So oftentimes you'll see we will adopt protocols that everybody in the CIN will follow. We report quality data to the CIN, and then everybody's evaluated within the CIN. You can be removed from a CIN if you are not performing in your quality metrics, or if you're not engaging in the education or the required meetings and things like that. So we'll follow common care guidelines for certain conditions and work together to improve patient outcomes and then reduce unnecessary duplication of services. So another big piece of the CIN is coordination of care. So moving patients between facilities. If there's something we can't provide, are they going to another facility that's within our CIN? And if so, making sure that we're not duplicating any services in that transition. Important things regarding the CIN, what it does not mean, because it can be confusing, and I just want to make sure that that's very clear. By joining a CIN, the hospital is not being sold, it's not being merged, it's not being acquired. Local leadership remains, everybody remains independent. Services are not being moved out of the community, and it does not mean that we're becoming a part or owned by a larger organization. There are a couple of CIN opportunities popping up right now in Kansas. All of them do have a large facility connected with them. So there could be some misconception that by joining a CIN that has a big healthcare provider name attached to it, that you're becoming a part of that health system, and that is not the case. Everybody remains independent within the CIN. So on the little handout that I gave you, it just kind of gives that brief overview of what the CIN is, and then also some of those frequently asked questions. We will be looking to join a CIN. We'll probably sign within the next couple of weeks. Truly, the Rural Health Transformation Funds are pushing everybody towards that, and it's one of those situations where eventually we're going to have to, and if you don't make that move now, you'll be left on an island alone. There's a lot of benefit to a CIN with clinical coordination, but then there also comes benefit from a financial standpoint as well. Again, we can participate in value-based care programs, but eventually it also allows you to go to the table jointly for payer negotiations. So currently, Coffee Health System, we're very small. If a commercial payer comes to the table with a contract and we don't like the terms of it, it's easy for that payer to walk away because we're so small. But when you're looking at a CIN and you have multiple hospitals working together, that becomes a much larger pool, and they're much more likely to negotiate terms of contracts at that point.
Is there going to be any membership fees to this or dues that have got to be paid?
That's a great question. It depends on the CIN. So there are a couple that are popping up that are truly from the ground up, so they are brand new. And those particular CINs, there could potentially be some fees involved because it does take quite a bit of resource to get that stood up and infrastructure in place. The opportunity that we're most heavily looking at is through the KU Care Collaborative. It's a group that has been around since 2014, not as a CIN, but more as a quality collaborative. They are transitioning to a CIN, and with them there is no startup cost. There's also Rural Health Transformation Funds available to help start up CINs, so some of those that might cost money may actually not if they're awarded some of these Rural Health Transformation Funds. But generally speaking, moving forward, we should not see any sort of funds having to be poured in directly to the CIN. You could potentially see some dollars have to be spent on initiatives within the CIN if we need to implement a system or an interface or something like that. There is a potential there. Any other questions?
How many hospitals would be involved?
Yes. Honestly, I truly believe that every rural hospital in Kansas will be part of a CIN once this is said and done. The KU Care Collaborative, when they were their quality group, they had 93 participants in their group. Now, will all of them join the CIN? Probably not. Some will probably go other directions, but I anticipate it will be a very large group.
How many CINs statewide do you think there will be?
I am aware of 3 that are trying to get started, and that includes the Care Collaborative currently. Mm-hmm. So that doesn't mean that there couldn't be others that pop up later on too. And by joining one CIN does not mean that you can't join another CIN. There are rules that you can't compete CINs against one another. So if I'm doing pair negotiations with this CIN, I can't join another one to also do pair negotiations. So it doesn't necessarily limit us from joining other groups as well, but we just have to be careful with what we're doing with each group.
And that CIN is kind of backed by the governor right now.
It is, yes, very much so, very much so. Any questions regarding that? Okay. I'm going to let Ray cover financing.
Handouts.
So they have the handouts on the back there. Yep, do you need a copy or are you good?
No, I don't.
Okay.
Good morning. I'll start to keep it short and sweet. You should have a couple pages here. One of them being an income statement. And then you've got some key volume indicators, so if you don't mind, I'll go over this page right here, the actual versus budget. If you focus on the very last column, you'll see that how we finished the year. We were slightly below revenue by $3.1 million. Okay, so if you go 2 columns to the left, you'll see the 41,978.13. That was our actual revenue for the year. We had budgeted 45,000, so we did come in lower than revenue for the year. But if you go to the very top of the very last column, you see a minus 3.18. That means that we collected over 3% more than what we anticipated to collect of what we actually billed out. So the net impact of that is that even though our revenue was down $3 million, and the increased collections only impacted the net patient revenue by $327,000. So our net patient revenue, again, if you go to the left, $23,394. So out of the $41,970,000, we estimated to collect about $23,394,000. Okay, which means that we're collecting about 56% of what we bill out for the year. Okay. Stacy was talking about the 340B revenue. If you go to the other operating revenue, if you focus on the third column from the right, that $1,948,000, that is predominantly 340B revenue. Okay, we did finish slightly lower than what our budget was by about $190,000, and if you add that to the 327, that 518 total revenue is below budget, but on a $42 million budget, that's not all that bad, relatively speaking. Some of the things that we were able to do in our initiatives is that you'll see salaries was lower than budget by $712,000. Supplies did go up, and a lot of that relates to the 340B program. We did notice within 2025 that the pharmaceutical costs went up fairly significantly, so that we are making money on the 340B program, but as that price continues to go up, our margin will continue to go down on that program. So if you go to the very last row, and if you go to where it says year-to-date actual December 25, which again is that third column from the far right, we generated a loss of $561,000. Okay, but that includes a non-cash depreciation expense of $1.7 million. So we actually positive cash flowed prior to that non-cash expense of about $1.2 million. Okay. Wasn't a year in 25 that we spent a whole bunch of money on capital improvements. It was really, hey, we got a bunch of debt that we really need to focus and pay down. When I compare that, this called EBITDA, earnings before income taxes and depreciation, which is basically your bottom line minus your depreciation expense. If I go back to 2023, we negative cash flowed $800,000 in '23, so to actually positive cash flow of 1.2 is a significant improvement. So again, we didn't spend a bunch of that money making capital investments. When we go on to the next page, you'll see that we really paid down a lot of the debt in 2025. So we had budgeted a loss of $901,000, which is that second to the last column. So we actually finished the year $340,000 better than what we had originally budgeted for. Within those numbers, there are some grants that we did receive. We did receive some grants, $216,000 approximately for EMS, but total grant for the year was $320,000. And then we also had that county contribution of approximately $150. All in all, it was a good year. Again, if you take a look going back to '23, it's a significant improvement over there. So, any questions on that?
You say you're getting roughly 56% of what you bill out?
System-wide, correct, yeah.
And last year it was like 52%, this put up.
Correct, exactly.
So it's
Correct.
It's improving all the time.
Correct, yes. So we actually, if we do a comparison of our collections for '25 compared to '24, we collected over $1 million more than we did in '25 than we did in '24. Even though our revenue was lower, we're collecting a significant amount. And again, that will reflect on the next page, because you'll see the accounts receivables go down drastically.
How does that correlate statewide, that 56%?
So I get asked that quite a bit. There's many variables in regards to what collection percentage you get. Individual contracts with the individual payers, larger systems get more lucrative contracts and better reimbursement. It also depends on what people are charging for their services. So it's not a statewide, because not everyone charges the same exact amount. So you really just want to make sure that you're always billing more than your best contract by the insurance company. One of the things that we did at the end of '24 was we implemented a prompt pay self-pay discount, which has proven to be very good both for the patients as well as for the system. So if a patient pays their bill within a year, they get a 30% discount if they're pure self-pay. If they pay within 30 days, they get an extra 20%, so they can get a 50% discount. That policy has increased our self-pay collections, along with some different collection initiatives. Our self-pay went up by $1.2 million in collections from '25 compared to '24. So,
is that based off of people with having no insurance?
Correct, that's
okay.
correct.
Okay.
So most insurance contracts, you cannot discount the co-pays and deductibles without breaching that contract. So this is a pure self-pay, exactly. So again, as you can see, straight across the board, there's very few insurances that are paying more than 50%. So when you're not giving a discount, the only people that are getting hurt are the self-pay folks, and then they just say, well, send it on to bad debt, because I'm not paying 90% of what you bill. So, make sense? Any questions on that? The key volume indicators, very first row, you'll see cash, December of '24, which is way to the left. It was $516,000. It did go up a little bit to $756 in December '25. Days cash on hand, which is essentially how many days of operating expenses do we have. So 500,000 is only a little less than 8 days operating expenses, essentially. Way to the right, 756, so it went up, so we're at about 11 days operating expenses. Gross AR is another indicator that shows very favorable. At the beginning of December, at the end of December '24, very first column was over 7 million. It is down to 5.3 million. So we were able to take a lot of that AR and convert it into cash. But again, remember, we're not getting dollar for dollar, so even though that went down 1.7 million, best case scenario, we only collected 56% of that, so. So gross AR days was 61 in December 24. We want that number to be as low as possible, so the AR is gonna go down. So that's 47 days of, gross AR, so that relates to how much revenue you're generating on a monthly basis, and how many days does that reflect, so. One of the most important things, as I talked about, we didn't spend a bunch of money investing in capital. We do plan to do some capital investments in '26, but in December 24, our accounts payables, very first column, was just below $2.4 million, okay? That has gone down to $1,029,000, so significant improvement there. So, cash collections, just overall collections with the systems that we put in place have really improved overall. And again, we will be looking at doing some capital projects in 2026, but also closely monitoring exactly what's gonna happen and how the impact's gonna be on the changes with Medicare and Medicaid and things like that. We've gone 2 months into '26. Revenue was a little bit low in January of '26, but we can't necessarily attribute that to anything that's going on with any adjustments to any of the Medicare and Medicaid programs at this point in time. So, any questions on that? All in all, it was a good year. So.
I was curious, what kind of capital investments are you planning in 2026?
Well, I think it's gonna be some repairs and maintenance primarily. We do have an issue that the system's been talking about, I think, for 10 years, so.
Probably,
There's some plumbing issues that really need to be addressed, and then there's, probably some imaging equipment, not millions of dollars, hundreds of thousands. And then, what were some of the other things that we?
The biggest thing is the sewer line that you
Yeah, the
mentioned.
sewer line.
Potentially a C-arm for imaging.
Right.
Would be another one, and then potentially bedside ultrasound as
Correct,
well.
for surgery, so.
Mhm.
As we increase our surgery volumes, we're gonna do some investments in some of that equipment.
Do you anticipate that to be manageable, I guess, with the funds you have?
As long as we're smart about it, yes. So, yeah.
But the plumbing issue has been ongoing for quite a while, has it not?
It has. That sewer line has been in need of replacement, and it continually gets kicked down the line. One of the arms branching off of that sewer line did break, and so we're moving forward on that this week, actually. So,
Right,
yes.
right, yeah. Yes, we can't kick that one down the road.
No.
They're kicking it down the hall.
Right.
literally. Any questions on that? All right, thank you for your time.
Thanks, Rick.
So do you have anything else, or
I think so, unless you have more questions.
I guess next time we see you, it'll probably be budget time?
Thank you so much.
Thank you.
That's right, huh?
It does.
Thank you.
Thank you for your time.
Take care.
Thank you.
No, thank you.
All right, are you ready for a break?
Sure.
About a 8-minute break. We'll recess at 10:04 for 8 minutes, so we'll be back at 10:12. Oh boy. How you guys? Okay, we're back in regular session, and it's going crazy. Okay. Sandy. Ryan, can you see for Angie's?
I tossed her something, sorry.
Yeah. Okay, next on our agenda, we have Noxious Weed Recycling Director Todd Bemis And, I understand you're gonna be requesting an executive session.
Yes.
Do you have anything before that, or just?
Well, I do want to, get approval from the commission to advertise and employ, 2 summer helpers for the noxious weed department.
Okay,
Okay.
that's separate from,
That's separate.
You wanna do that first?
That's up to the chairman.
Okay, so,
or you can, yeah.
advertise and hire how many?
2.
I've got a motion here.
It is tiny.
Two.
Okay, I would,
Advertise employee.
this is something you do every year, right?
Annually.
I would entertain a motion that upon the recommendation of the noxious weed director to advertise and employ 2 temporary seasonal laborers, funds to come from the noxious weed budget.
Did you make it?
I can, I'll make the motion.
No, I'll second.
Okay. Peters moved, McCurry seconded. Is there any other discussion? All in favor, say aye. Anybody opposed? Passes 4-0. Okay, check that down.
Okay. So I would like to request an executive session with each of the commissioners, Wade Bowie and Brandy Clark.
For how many?
Yeah.
10 to 15 minutes. We could probably do 10 if you're running short on time.
Well, we are tight. However, we can I think we can do 13 minutes. How's that?
Okay, perfect.
Is this regarding job performance or?
Non-elected personnel.
Right.
Yeah, job performance, yes.
Okay, I would entertain a motion to enter an executive session for 13 minutes to include each of the commissioners, noxious weed, recycling director Todd Bemis, Brandy Clark, and County Councilor Wade Bowie II, to discuss personnel matters of non-elected personnel regarding job performance under the Kansas Open Meetings Act, KSA 75-4319B1, to resume in the county commission chambers at 10:29.
I'll move.
Second.
Okay, McCurry made a motion, second by Avendroth. Any discussion? All in favor, say aye.
Aye.
Anybody opposed? Okay, passes 4-0. Executive session for 13 minutes. Okay. Okay, we're back in open session, and we just lost Commissioner Avendroth. He's,
Okay, I gotta get the teams up.
he's not feeling well, so.
Dropping like flies.
Yeah. But we still have a quorum.
I still think I.
How did you pronounce that?
Okay.
Oriad.
How you, Casey?
Good, hurry up.
Oh, there you are.
She was hiding back there.
I should have had this up already, sorry about that.
No problem. Should have set some of this stuff around earlier. next thing we have on our agenda is this is Zoom or Meet, whatever, a remote, meeting with Oriad RX concerning the PBM on the county's health insurance. Until then, we're gonna go through some special issue checks, or whatever you call those.
See how I'm gonna get it. If I join it here, it'll be on that desktop. It's got to be on this computer.
Got a little signal. That's right, it won't let me.
I'll get this to you in just a second. That's fine.
Sorry about that.
I'm not speaking anything.
I'll be polite if we have to sign that.
No, you can be having fun.
Morning, Brad. Good morning.
Sure.
Mm-hmm.
Yeah.
$365, you say? Here? This one? Oh, you're here. Maybe it'll work. Okay. Get to that.
I told her that we were having technical.
Okay. Same password?
Send me your phone.
I know.
Not me.
Something went wrong. The organization has disabled. There's the name of this browser.
Continue in the browser.
Okay, go back there.
At least we're being productive, right?
We are.
Still it is.
We're good.
Okay, allow.
There you go.
And I got.
Can you hear us?
Yeah, can you hear us?
Yep.
Yes.
Sorry about that. Having trouble
All right,
getting logged
no
in.
problem.
Okay, so we don't have a camera for you to see all of us here, Jeremy and everyone, but we have our Commissioner Todd Barker, Steve McCurry, and Mark Peterson, and possibly Michael Abendroth, who stepped out for a moment. So if you want to go on with
Okay.
the presentation, that will be great.
Yeah, I'll just tee it up real quick. Just to let you know why Darren is here and his team. Obviously, we've had some issues with our PBM med impact, so we need to find a solution. Darren and his team are here. When I say local, I mean they're in Kansas. I'll let him speak for himself and what he's going to do. But there's a savings there, but more specifically, it's the service that we need to take care of. And with that, Darren, I'm going to hand it over to you and let you walk through kind of what it is that Foria can do for Coffee County.
Yeah, I appreciate that, Jeremy, and nice to meet you, Angie. And we're we're really excited to present to you guys today. And so my name is Derek Price. I'm a pharmacist first and foremost. I'm actually a pharmacy owner. I own 8 locations in South Central Kansas. Have done that since 2010, so 16 years as a pharmacy owner, a small business owner here in Kansas. And I'm also the owner of Oriat RX. I'm one of 4 pharmacists that own Oriat RX as PBM. We've been in business since 2018. Have grown significantly in that time slot. So we're, as of today, around 150 groups is what we have. We have several counties here in the state, and we're servicing around 50,000 lives currently. And I have our senior account manager, account executive, I should say, Maria Manrique is here with me as well. And so if we decide to move forward, she will be your account manager for Coffee County. And so Jeremy mentioned the customer service side. So again, we're owned by small business owners, and that's exactly how we operate Oriat RX. There's nothing more infuriating than getting on an insurance call, you know, and you're on there for 3 hours trying to speak to a human and getting tossed around from this person to that person. That's not how we do business at Oriat RX. You will be assigned a specific account manager, which is Maria, who's on the call today, and that's your go-to for everything pharmacy. And so we believe in that one-on-one connection. And we've also kind of built our benefits like that as well. And so all of our specialty programs, so any of your members that have specialty drugs, they will also be assigned kind of a one-on-one advocate to walk them through our specialty program. And that will be their advocate moving forward, so one-on-one. As for the rest of our platform, as far as customer service goes, we do have a call center here in the United States, which is 24/7 for pharmacies and for, you know, really simple issues that occur for members to call. Like I said, it's 24/7 located here in the U.S. And right now we have a 14-second answer time and a 97% first call success rate. And so we really pride ourselves in that. We know people hate insurance and being on the phone with insurance, and so we've really tried to simplify things and make the best experience possible for people. We do have on our website, we have a portal for members where they can go log in, look up any questions they have really about their drugs that they're taking, or where they can pick them up, or what they may cost. And we do have an app as well. And right now we have 66,000 pharmacies nationwide in our network, and so should not have any problems with coverage whatsoever. You know, all the big chain box stores are in our network, and then all the independent community pharmacies are in our network as well. So I know that's kind of a 30,000-foot overview, but I really wanted to be on here today to answer any questions that you might have.
I'll go ahead and just maybe walk through what the experience would look like if, because there are a handful of people that have specialty meds.
Yeah.
What will that look like? I know that there is more of a proactive approach. So if we were to make this switch, what is that going to look like for that handful of people that would be on those specialty meds?
Yeah. So we understand that specialty is, you know, sometimes specialty can be up to 50% of your total drug spend, you know, and so it's very, very important that we take care of the specialty. And so we've devised an in-house program that does that. It's a fee-based program, so you get charged one time per case worked. It's not an ongoing charge for these members. It's a one-time fee for us to go find lowest net cost for you for these drugs. And we have a barrage, a myriad of ways of doing that. And so, but what it looks like from a customer service standpoint is if we can identify the members that are on specialty meds right now on your current platform, then we can proactively assign those members to advocates on our team, and then we can go ahead and touch base and get them ready for the process when we take over, if we take over the business in whenever you guys renew. And so that's kind of how we proactively do that. Now, say somebody in the middle of the plan year gets prescribed a specialty drug, okay? So right now, these drugs require PAs, so nobody's going straight to the pharmacy and getting these medications, okay? Because usually it's a complicated ordeal. They're really high dollar. So a member goes to the pharmacy to get a specialty medication. It's denied at point of sale, and the PA process is started. But in the meantime, we send the pharmacy a message to give the number of our patient assistance program to the member to call us. And so once that member calls us, then that's when we initiate the patient assistance process of going to find the lowest net cost for that drug. If for some reason the pharmacist doesn't give them the number, or they lose it, or whatever, our team is proactively monitoring those as well. And so once we see those rejections, we will contact the member within a 48 to 72 hour time period, and then initiate the process. And so we do build in some transition fills, and so we like to write in the SPD at least 3 transition fills for these members, because the intent of the program is not to limit access whatsoever. It is to legitimately go find the lowest net cost for these drugs, and sometimes that takes time. So we don't want the member to go without drug while we are, going through all these different processes of finding lowest net cost. And so that's the way that we built this system, and it's been very, very successful. And, it's a different way of doing things when you're assigned one person that's the advocate from the PBM standpoint. And patients generally really, really enjoy it, because we're checking in with that customer every single month to make sure their medication, their therapy is going well, and helping them with refills and all of that stuff. So that's our patient assistance program kind of in a nutshell.
So if we get, information prior to the effective date from, currently TPA is Edison, we get that information to you, day one, you're making a soft touch to those members and letting them know this is what's going to happen. It's a live person, they speak English, there's no problems, and we're off and running.
Yeah, and really we probably would do it before go live, so we would probably reach out a couple of weeks before and just kind of give them a heads up, hey, we can't actually do anything until go live, but this is going to be what happens after go live. Because, I understand, I've, worked behind the counter, stood across from angry customers for 16 years now at the drugstore, and I understand what that's like. And so we want to try to limit those type of situations and be as proactively communicating with those members as humanly possible.
Perfect.
If I
Do you
may
have any
ask-
questions?
Yes, I do. Steve McCurry. I think part of the problem that has been going on is communication between farm and med. And if we should go with you folks, we shouldn't have those same problems, should we not?
Correct.
I mean,
Yeah.
because part of the problem is because the deductibles, it appeared to be a real mess for a while, or it still is.
Yeah.
Yeah, and Darren probably has something to say about it, but I also know that Oriad and Edison do have a feed, so there will be no issues connecting together.
Okay, very good.
Yeah, Steve, we basically send data to them, correct me if I'm wrong, Maria, but 3 times a day, right? What is how often that feed goes, or is it just once a day?
So accumulators are sent once a day, and then we get eligibility potentially every day, but it can be 3 times a week. It just depends on that file schedule yet.
So your accumulators, what you're referring to, they go every single day. And then eligibility is either every day or 3 times a week.
How long would this take to transition where you guys were at 100% with all of our employees to transition into you guys taking over?
Yeah, so basically on day one, because we would work with Edison to load eligibility files, and then we do tests to make sure that everything is working correctly before go live. We have our own in-house IT, so we're not farming that off to somebody else and relying on someone else to do the work. We do it ourselves. And so literally on day one, all of your members will have cards and need to give those cards to their pharmacy, and it'll just be the pharmacy sending the claim to us rather than MedImpact.
Yeah.
Sounds like you guys seem to have it going on in the right direction.
Yes, sir. Yeah, we've been, it's been kind of a breath of fresh air, I think, for our clients because, like I said, people hate insurance just because of how big it is and how unpersonal and the lack of communication and all those things. And we're trying to do the exact opposite at Oriat.
And then,
That's a way to
one thing that I think is worth mentioning is Oriat is a 100% transparent PBM. The way that they're paid is, correct me if I'm wrong, it's per claim, so it's whatever it is, $8 per script or whatever. Everything else flows back to you, the county, whether that's the savings on the drug or the rebate. All of that comes back to you. If there is that off chance, because I know that there are a handful of people that have specialty meds. Darren alluded to the fact it's a set cost for them to set that up for you, but all of those savings come back to you. Darren, I'd maybe just talk about an example of a drug that we might know that even though it's whatever it is, $1,500 for you to put that all together, talk about the savings.
Yeah, so, one of the things that's going on in the marketplace right now is biosimilars. Okay, I'm sure you've heard of those. So Humira and Stelara, for example, right now are available in biosims, is what they're called. They're basically generic drugs for specialty meds. But what's happened in the marketplace is all the PBMs have left Humira and Stelara on their plan because they're making a ton of money off the rebates of those drugs. So, for example, Humira is costing $144,000 a year, which you may not have any of those on your plan. I don't know. Costs $144,000 a year, and it's available as a biosimilar drug for $12,000 through Cost Plus Drug with Mark Cuban. And so, on day one, we would identify those Humira patients and give them, our clinical pharmacy team on staff would give those guys a call and convert them to the generic biosim. There's no reason that somebody should be on the brand name versus the generic. And so the generic biosim costs $12,000. So right off the bat, you're saving $130,000 on that one claim, and so that's an example of what that would be like, and so, go ahead. Oh, I thought you had a question. And so, that's what that program's intent is to go find those drugs for the lowest net cost, and so for that service, we would charge a $1,500 flat fee for that service. Most PBMs are going to charge you 30% of savings, okay? And so if they're going to save you $130,000, you're going to pay $40,000 to get those savings. But that's not how we operate. We just do a flat fee and go on down the road. So for $130,000 worth of savings, you would pay $1,500, and then we go from there. Another big topic right now is international sourcing, which we can discuss that, whether you guys want to do that or not. But there are a lot of meds that are a tenth of the price internationally as they are in the United States. And so I'm a pharmacist. We have vetted this program upsides and down. We've had Hinkle Law Firm look at this program for us as well, and it's a legit program, So we get drugs from tier 1 countries, and it may be one or two people on your plan. And again, that advocate will work well with these people, and it's the exact same drug, exact same labeling, exact same box. It's just coming from a different place. And so we have that option as well. And again, the savings there is pretty significant if you want to go down that route.
Angie, do you have any other questions you think of?
I think some of the questions I had were answered the longer we talked.
Yeah, that's what it was me.
Casey, do you have anything for him?
All right, well,
You know, another thing I just mentioned real quick, you know, I'm a small business owner. I like to do business with local people. And, you know, as the owner of the company, you guys are going to have my direct contact information. No other PBM in the marketplace is going to give you the owner's cell phone number, you know, but I believe in this product so much, and I want to do a good job for you guys. And so if there's ever an issue, I mean, Maria is really the one. She's the stud of the program. So she's really the one that you want to talk to. But you know, just so you know, you'll have my contact information as well. And so if there's ever anything that I can do for you, you just have to call, email me. I'll be right there for you.
We would probably just go ahead and let them know that we'll make the switch. To order.
Okay.
And then they'll send us probably documents and stuff.
Yeah, so I would lead your implementation process. So once I get the green light that we are gonna go live, I'll start communication with Jeremy, and with Kate as well as you all, there. And then we'll just kind of go from there. Probably have a couple of kickoff meetings just to make sure our T's are crossed and our I's are dotted. But usually I like to see a 45-day implementation, but Jared knows me, I've done implementations in 3 weeks. So,
well, yeah, we've got time. Yeah, we've got time. What I don't want to do is try to hurry and rush it. But when you guys tell us, hey, let's go ahead and move forward, then we'll get the ball rolling, and it'll be pretty seamless.
Yeah. And I don't want to paint like sunshines and rainbows too much. You know, there will be issues that arise, but our commitment is to take care of those as fast, as quickly, and as effectively as possible. You know, and so that's why you have Maria's direct contact. You ever hear anything is wrong, any problems, you contact her and we fix it, you know, within a couple of hours, not a couple of days, you know. And so that's our commitment to you, is that there will be problems. With any switch, there's some disruption that happens, but we're going to be on top of it and take care of those things for you guys.
So would the employees themselves be able to make direct contact, or would it just be through, is that correct?
Yeah, so that they would make direct contact through our member help desk.
Uh-huh.
And so that's that 24/7 phone number. But you as the entity will have direct contact to Maria. And then if you need us to reach out to a specific member to go through a problem, then we're happy to do that for you.
All right, very good.
You kind of need that
No, you do.
tier level.
Yeah.
Where are you guys headquartered?
I also, sorry, Sorry, guys.
What was that other question?
I was asking where you're headquartered out of.
All right, so Angie, you go ahead and go, and then Maria will go.
Oh, I wasn't saying anything.
Oh, okay.
Todd
Well,
was
it's back
asking.
to you, Maria. I feel like a news anchor.
Yeah, Todd was
Stop,
asking.
light, go, red light, go.
Todd was asking where you guys were
gonna
headquartered.
Oh, Dodge
okay.
City. Dodge City, Kansas is where we're headquartered. But I live closer to the Wichita area.
All right.
So it's nothing international that we'll have to deal with.
What's that?
It's nothing international that we'll have to deal with, or
No.
East Coast
No,
or West
no.
Coast.
Not at all. No, you'll be dealing with local Kansas people here.
That's appreciated.
Yeah, and this isn't a paid commercial for Darren, but I can tell you, I can attest to the fact that the handful of times that I needed some help, one of them was on a Saturday. He picked up the cell phone, answered the question, and got it taken care of on our conversation. Just so that's Gallagher works with a lot of different PBMs, or we have access to other PBMs. Oriad has been hands down one of the best or most easy PBMs to work with specifically for customer service issues. Now it's your turn, Maria.
Okay, green light, go. I was just gonna kind of echo out that, you know, as we go through this transition period, we understand that there's gonna be disruptions, there's gonna be questions. Even though we try to mimic everything to the same, it may be a little bit different. But I am comfortable with HR, though, giving my contact information, my email address, just to help those individuals. We understand that some people just need a little bit more hand-holding than others, and that's fine. I'm very well equipped to kind of go through those courses with them.
Yeah, Maria's got over 17 years, I keep trying to say 30, Maria, I'm trying to age you, I'm sorry.
No!
She's got over 17 years experience in the PBM space, so she's been there, done that, and probably seen it all.
That's probably just how well knowledgeable I am.
That's-
If you want to put that 30, yeah, no, I've been doing this since I was 6.
My bad.
It's okay, Jared. I'll expect a Christmas card.
Open mouth, insert foot.
Yeah, I'm really good at that.
I mean, that just goes to show we're real people.
Yeah.
If you don't have any other questions, we'll go ahead and jump off, but if you do have questions after this, reach out to me, Kate, Darren, Maria, and we'll get the questions answered ASAP.
All right, we appreciate you meeting with us.
Yeah, thanks so much.
Thank you.
Thank you.
Thank you.
Thanks, bye-bye.
Bye.
Okay, so the next step that we need to do is just.
Well, I guess if you guys wanna give us the thumbs up, we'll go ahead and get the ball rolling, and then there'll be documents to sign later, once they get all that prepared.
We don't need a resolution for that, do we?
I don't think enough resolution.
I think, but we're missing Mike and Wade,
Yeah, but I think they'll.
I think they were.
When we talked last time, they both were very,
Yes.
especially being, these guys Gallagher and giving
It's
their blessing.
recommended, yeah.
And after meeting with them and hearing from,
It sounds-
Oriad, it sounds, I'm even more comfortable.
I do too.
I think a change definitely needs to happen.
Yeah. I had contacted, they'd given me 3 references to call, and one of them was City of Winfield. And they had previously been with Blue Cross Blue Shield, but the rates were just getting so high and unaffordable. And so he said the first few months, I talked to the city manager. He said the first few months were a little rough, but he said, it's been great for 3 years that they've been with them. So expect a little bit of disruption, just like you said, but they went from spending $750,000 a year to like $500,000 a year. And then, yeah, they have 200 employees there and 500 are on the plan. And he said, in the beginning, they didn't have as many employees and stuff like that 3 years ago, but he said they've gotten more staff and more resources, and so it's seamless now. So I didn't call the others. After I talked to him, I was like, I think they're pretty reputable, so.
You're comfortable, and it seems like Gallagher's is.
I think it's a push.
I do too. I do too.
We'll get the ball rolling on it then.
Got 3
Okay.
thumbs up.
Yep.
Yeah.
All right.
Awesome.
Thank you.
Yep.
Anything else on that subject? We'll move to our 10:50. Jenny?
Not me?
Yeah.
Okay.
We're not too far behind.
No, not bad.
That was a really good presentation.
It was.
Yeah.
Very personal.
Yeah.
So I just wanted to give you guys an update from the Economic Development Office. I know last week, I think Mark or somebody had asked about an update on the Coffee County Revolving Loan Fund. We did get everything signed from Lindo Enterprises, so that's all good to go. So including that new RLF loan that we did, we've got 5 current loans from the county. Those would be Coffee County Concept, Easy Sports and Outdoors, Jade Seed and Outdoor Supply, Lindo Enterprises, and O Auto Wash. And all of those are current on their payments. They've been either doing their regular monthly payments, or we have one that does just a yearly lump sum payment on those. And then just to know, our current loan balance that we have in that fund, you guys get that report every month, but it's $427,806.54. So I don't know if you guys had any other questions about the current loans.
Say that's the balance in the fund. How many dollars are outstanding?
Total under our remaining balance as of this month would be $593,012.35 under remaining balances.
All right. Thanks for that update.
Yep. A couple other things I've got going on. I think I told you guys last time there's been a lot of grants that have been coming out from Department of Commerce that we've been looking at. I did get the application for that Rural Champions grant submitted. I also submitted for 3 downtown Burlington businesses for the signs grant of about $15,000 total, so they would break those up if they were awarded about $5,000 for each business to redo one of their facade signs. I've also been working with a business owner in Waverly that's redoing the Opal, the downtown business there. So this morning we got a grant submitted for her for the Department of Commerce Revive and Thrive grant. So that would be to continue her renovation for the second story of the building. So that one's just all funds that could go towards that. There wasn't a required match or anything. They just needed a city, county, or nonprofit to be the sponsor for the application. So we did that. Also, on the other side, I know we've got a little bit of funds through my office for small business grants. So I've had some applications coming in for those. This year we have awarded 2 small business grants so far. One was $1,000 for Lulabella's Flower Farm. They are trying to expand their attraction, so she's got a lot of people that come in during the summer for events and flower picking. She's building a butterfly habitat to try to get more people on site, which I think will be really cool. And they're investing their money for I think the total project's about $5,000, but the other one we did award to 11th Lane Roastery for $1,000. They are planning a combined billboard on 75 Highway with Wildcat Grill to, again, keep driving that traffic, getting people to stop. So I think it was a good one to help them get the billboard, and then they'll pay for it for the monthly cost on that one. So I think it's good those applications continue to come in, and they're not a huge amount of money investment, but I think it really helps for those small businesses for some of the projects they're doing. Another thing I wanted to kind of give you guys a quick update on, if I had, which one was it? Oh, here we go. Sorry, I got my papers here. I know I had told you guys a while back we were awarded that almost $6,000 for the Kansas Tourism Grant. So I've been working with Cherie and Osage County on just some combined marketing. And one thing we have already gotten done is we've worked with Young Graphics, which is here in Coffee County, and they've developed just a simple logo for us for this project for Drive 75. So what that'll do, and just the example is just kind of how the logo could be used. So we wanted something that was just clearly visible, that could lead to like a website or some other information, and then now we're gonna work on using some of the remaining, grant funding to do like a web page that would land you to Drive 75, it would give you a map, and then from there, it would take you to like Coffee County or Osage County, list of businesses, events, things like that. So just something we could do together, to kind of make our marketing go farther. So just wanted to let you guys know how that's going. I think it's going pretty well. Other stuff I've been working on, continuing to have meetings with Kansas Infrastructure Hub, Osage County, Carl, and then representatives from Public Wholesale Water Supply District 12. Now that we've got the water study, we're continuing to look for grants or other funding to start kind of checking off some of the boxes on those projects that we're looking at up north. So we'll continue to meet at least every month. I know Jennifer from Infrastructure Hub, I think last week, sent me, there's starting to have some of those federal water grants are coming out, so we'll look at those and see if any of them would kind of fit. It's a big project up north, so we're seeing if there's a way we can kind of break that down into smaller chunks and go after some of that funding for that, especially since it's got a regional impact. They feel there could be some federal grants we might be able to tackle for those. Other meetings I've been having, just to let you guys know, and I can't remember who I talked to, but I've been continuing to meet with the team periodically from Burns and McDonald. I know they had done some work with our north property before looking at getting shovel ready when we had the previous project we were working on. So just kind of continuing to talk to them about different development possibilities for that kind of piece of land up there, including possible viability for the energy project. I know we're still waiting to hear with like TerraPower, those kind of projects, if that ground would even be suitable for something like that. I can't answer that. So they're gonna look at what information we already have. They have an energy team that does those kind of projects. So they're gonna just look at it and kind of give us some more information. And then the last thing I had, I know I emailed you guys some information last week that I had received from Kansas Department of Commerce on the data centers. If or if not, you guys had a chance to look through all that. They also sent me a much cleaner one-pager that's a little bit less lengthy. So I wanted to make sure you guys had that too. And really, I think the thing from Commerce that they've, and kind of having some conversation with them on this, is they're starting to get a lot of questions from rural communities about data centers. I think there's site selectors or people that represent those businesses that are starting to look at different land or possibilities of projects in Kansas. I know we've had at least one since I've been here in the last 12 months that's kind of started asking about a project here. Currently, I don't have anybody that's contacted me, but I don't think it'll be the last time that we hear about data centers in our area, whether that's in Coffee County or one of our adjacent counties around it. So it's good to just sort of have that information on hand if you guys get questions. Obviously, some of the big topics that come up are water usage, energy usage, noise, and impacts on the environment. So I think from all this information, what I take away is that there's different technologies and there's not a one-size-fits-all when it comes to data centers. So my recommendation would be, if we have those companies that are looking at our county, to kind of look at them on a case-by-case basis, because there's, some that are very small, they're going to have a smaller footprint, to there's, mega sites that are very, very different animals. So this just kind of gives you an idea of how you might be able to answer some of those questions, and there's some, resources on there if you want to learn more. But if there's anything on here you want me to do more research on, or you hear something, just let me know and I'm happy to dig into it more.
Have you been affected by the RAD, isn't that what it's called, Emporia, or?
Oh, the
RDA?
Yeah, the RDA.
RDA.
I know they're moving a bunch of stuff around right now.
I didn't know if that left you out in the cold, or if it's gonna all become a Lyon County deal, or?
I haven't, like, mostly my contact with them has been through Emporia Main Street because, you know, looking at small business programs, and we did have the meeting with some of their members a few months ago. We still haven't got a regional letter that we were working on to Commerce. I don't know if that's stalled because of some of that rearranging. For us, we've still been moving forward, you know, as they're looking at sites for that project or for other projects. If we, you know, have support regionally, I think that's best. But I think that even with the intent of the letter wasn't that any one of our counties couldn't be pursuing those projects without that letter. It was just more of a very fancy letter of support for what we're doing. But I continue to kind of communicate with Casey Wood to see if that's something.
I didn't know if you're gonna lose out on some valuable communication there or not, that we needed to look at a different avenue to go on with the vehicular.
With what we were working on with them in those meetings, like I said, it was just mostly a letter of support saying our region can support a project like that, and we have several different options of communities that are interested. But we've already put out our own resolution and letter of support from us, from emergency management. So I don't think not having that other letter is going to disqualify us from potentially being a site for a project like that.
Is there something that you could work with Ryan, I'm blindsiding here, but a letter from Road and Bridge to talk about our excellent roads, to help them with that?
Yeah, I think that's something I can work on a draft. If you want to, I can email it to you.
Just to promote ourselves more, and I think the more we can blow our whistle on this, the better we're going to be with it.
Yeah.
Definitely.
And I think from what I've heard, there's been ongoing talks, and even the last couple of weeks, you know, above my pay grade that are happening, and I continue to try to remind all of my contacts, at least every couple of weeks to once a month or something, that we're still here and we're still interested. So
from my little bits, pieces I get, I think we're still in the running, but just keep poking.
Yeah, so I've been trying to, you know, nicely say that.
In a positive way.
In a positive way, without, you know, trying to hurt any conversations that are going on elsewhere. But yeah.
Excellent.
Yeah, we'll keep working on that. And I don't know if Heidi came in earlier. I've been in the meetings about the airport plating as well. So we should.
Yeah, she was in earlier.
Yeah. So we're just gonna keep moving things forward on big and small projects. I think that's the best way to.
Have you had anybody ask about anything at the airport? Just question-wise, is feeling you out, or? I mean, you don't have to talk about who it was, but you're getting some contacts.
I think yes. There's been some, you know, meetings I've attended kind of regionally where it's been brought up interest for that land out there, and then also, as you know, with some like the Team Kansas and others, where I'm specifically going to other areas in Kansas or even other states to talk with site selectors. As I've told them where that land is located and kind of where we're at Coffee County-wise and what we've got here, definitely has generated some interest and hopefully follow-ups.
Sounds like you're on top of things.
I try.
Yeah.
But I appreciate it, and you guys know where to find me if you need me. Thanks.
Okay,
Thanks, guys.
appreciate the
Yep.
update. All right. Our 11:05, Connie Lawrence.
And I was gonna see, maybe we should wait till next week when the other two are here and talk about it some more. It's continuing from last week.
Okay, yeah,
Does
Mike,
that work for you guys?
yeah, we should have a full board
That's
next
what I
week.
thought. Okay, well, I'll schedule with Angie for next
Anything you
week.
wanna tell us about the valuation notices?
We haven't had much information from, or any contact from taxpayers. We did have one hearing set up, but other than that, our funds are quiet.
I mean, everybody should have received it by
Oh, yeah.
now, right?
Yeah.
So. Okay,
Okay, thank you.
all right, thanks. Well, we're almost on schedule.
We're almost on schedule.
11:15, Road and Bridge Supervisor, Ryan Durst.
Not too far off, I guess.
You can close the gap.
Yeah. Well, good morning.
Good morning.
A few motions for today. The first one would be CP2 for Tracy Woods. She's going to be the new hired landfill clerk. She started last week. So it's just a motion to approve that. So.
Okay, I would move to authorize and direct the chairman to sign the CP2 for Tracy Woods, landfill clerk, solid waste. New hire, wage classification 25-03, wage $20.32, effective March 3rd, 2026.
I'll second.
Okay, I move.
I was gonna say,
Steve Curry seconded. Any further discussion? Any discussion? All in favor say aye.
Aye.
Anybody opposed? Passes 3-0.
Thank you. The next, this will be our first summer help hire. This will be for Caden Hawkins. He worked last year out at the landfill for us, and so he's wanting to get some work in over spring break. So we got some stuff out there, cut some tires and whatnot. So that'll be the first one we get started with. Last year we actually had two summertime kids that worked out there. So I know they both have involved in some things where their schedules, they weren't here 100% of the time. And so I think that's probably going to be the same thing this year. I'll have another high school kid that, they have numerous summer camps and stuff that they're both gone for different things. So we'll look at having a couple employed out there again this summer.
Okay, I would entertain a motion to authorize and direct the chairman to sign the CP2 for Caden Hawkins, labor crew member, solid waste, wage classification 5-02, wage $16.25, effective March 16th, 2026. Number of hours not to exceed 500. Okay, Parker moved, Curry seconded. Any discussion? All in favor, say aye.
Aye.
Anybody opposed? Passes 3-0.
Thank you. Next motion would be for the liquid asphalt. I had bid openings last week. And so there's actually 3 different companies for the various oils. Right Asphalt for our chip oil, and Ergon for our patching oil, and then Coastal for our fog seal oil.
Okay. I would entertain a motion based upon the recommendation of the Road and Bridge Superintendent to approve the bid submitted by Wright Asphalt as being the best bid for CHFRS-2P. Is that Ergon? Ergon Asphalt and Emulsions Incorporated as being the best bid for SS-1H, and Coast Energy Corporation being the best bid for CQS-1F, as shown in the bid tabulation dated March 4th, 2026. Funds to be paid from the Road and Bridge Fund.
So moved.
McCurry moved, Barker seconded.
Before we go, Ron, is there any stipulations in this? This will lock it down, what's going on with the global oil market?
Yeah, I know, I had two of the vendors reach out to me and just kinda wanting to verify our approximate gallons and, kind of the time frame, and so I know they were probably scrambling a little bit, you know, I know there's some uncertainty, but this is, I mean, what we entered into, this is the bids they submitted, so.
Okay. So there's no bid expiration date or whatever?
Nope.
Any other discussion? All in favor, say aye.
Aye.
Anybody opposed? Passes 3-0.
Thank you. Next would be the bid for cold mix. We had two suppliers put bids in, and the best bidder, a little bit there, is gonna be 8-pack shears.
Okay. I will move, based upon the recommendation of the Road and Bridge Superintendent, to approve the bid submitted by APAC Kansas Incorporated Shears Division as being the best bid for cold mix patching material for 2026 road maintenance, as shown in the bid tabulation dated March 4th, 2026. Funds to be paid from the Road and Bridge Fund.
I'll make that motion.
I'm
sorry. I'll second.
I made a motion. McCreary seconded. Any discussion? All in favor, say aye.
Aye.
Anybody opposed? That passes 3-0.
Thank you. Just a brief update on the North Property Survey. So, I sent the initial information to Brosmer. I know we were out last week getting some shots out there. We'll continue this week, get the rest of the shots that we need to take. And I think they're gonna have to dig for one section corner. But he talks like 2 or 3 weeks, to get that survey completed out there, so.
So 2 to 3 weeks.
Yeah, my next, gonna request an executive session, but I need Wade to be here for this one, so.
Just seen him for what, did he say where he was going?
No.
Let's see. Yeah, I sent him a text. Well, if you wanna hang around a few minutes, we'll, see if we can
I
get
think he
up
was
there.
researching something in the deeds office on a road closure.
Oh, okay.
Coming up, I think, so.
Well, while we're waiting, we can start roundtable, I suppose. Do you have anything, Todd?
We got a big list, but just wanting everybody gone before we on.
Okay. Anything to say?
I'm working on a couple of proclamations if you wanna do for the schools, but I'm not done yet, so.
Something that we need to pass this today?
Yeah,
Okay.
so,
Well, and I understand that, speaking of up north, that, the house is vacated now, so.
Do we know if it's secure, if we need to maybe lock the gates to it?
they delivered the keys and we gave them to Wade.
But I mean, if we can lock the fence gate, the wire gate.
Is it got a
Just keep-
padlock on it?
I haven't seen one before, but I'm thinking we need to, maybe just prevent
The one down
traffic.
the road to the west is.
No, coming off the highway,
Oh,
going
yeah,
down
yeah,
the hill.
yeah, okay.
We might talk to Wade when it gets in, but, I mean, if you're available, I mean, if you can possibly check it out or whatever. If you don't mind doing that.
Okay. He did mention something about he had somebody going with cameras and photos of the building, look for if there's any problems with it. I didn't know.
I'm gonna give it to you and have you write what you want.
We can line up, probably, I think we're gonna try to get 3 appraisers maybe that we're 2-3 weeks out on the survey, so, we should be able to move forward even faster than what we intended, so.
Mark it up if you want, and I'm gonna put the other one on.
So we moved out.
I think just last week, I believe. Within the last week or 2, so.
Yes, he did. No, he didn't. That's my daughter.
I think that one's okay, I think, but I don't know how the other one. Oh, I do have a couple things. Before I forget. So, Tim Johnson is on the Kansas Natural Resource Coalition. You guys kind of told him to go on your behalf or whatever. They sent us a new letter wanting, are we gonna renew? We have an invoice if we're gonna renew for $5,000 for the membership dues.
That's for the,
KNRC.
KNRC.
Kansas Natural Resource Coalition.
I think we're dealing with them with the Ag Commission and Natural Resources also with that committee.
Yeah.
The way things are going right now, we probably need to
Stick with it.
at least for the time being.
Okay.
Yeah.
Wouldn't you guys agree?
Yeah, let's see how it turns out. We'll do it one more.
At this point, yes.
Yeah.
Okay. And then, April 16th of this year is the Southeast Kansas Spring Meeting in Eureka. So are any of you able to attend, or?
I think I might be able to go to that.
And what?
It's the 17 counties.
Oh, okay.
We meet twice a year.
Okay.
What was that called again?
Southeast Kansas. It's Southeast Kansas elected officials.
Spring meeting.
Yeah.
And April what?
April 16th.
Eureka.
Uh-huh.
Yeah, I can go to that.
I'm gonna lay it off.
So 2 so far. I'm supposed to let them know today, and even though 2 aren't here, I mean,
Yeah.
I can always let her add 2 on.
Yeah, I should be.
Okay. Okay, on health insurance, as we are getting ready for renewals and all of that, we have our booklet that we hand out to all county employees, benefit summary booklet. The one question that Casey and I had was, what do you want the contribution limit for the county to put in for employees to be this year? You don't have to increase it, you can leave it the same.
What was it last year?
For, so for a single person, it was $2,075 per employee. For a family, it was $4,150.
if we kept it the same, would that be, is that sufficient?
Was there
Uh,
any issues, comments, concerns with what?
No.
Were they maxed out by a bunch of people?
Were they-
There's contributions individuals would make for that?
Can you say that again, were they maxed out?
Did people make that a maximum amount of contributions, the 4,000, whatever?
Oh, the maximum, no, is, for their HSA account, so, for employee only, it's 4,300. So like the county would pay
Oh, okay.
not quite half, and then same for the family, and the family was 8,000.
Okay, I think we're suitable like that, unless
Just
we got,
stay-
if we have everybody meeting that.
I'm
Might
good.
want to look at it then.
So just leave it there for
Yes.
this year? Okay. All right, and that I think is all I have. Yep.
Wade said he'd be here in just a minute. You probably tracked him down.
He's finishing up there in the deeds office.
Okay. Have you been around the Bailey place?
Well, yeah, I went there the other day, Thursday, up there doing some surveying.
Are you going back up there sometime?
Okay, so hold on.
I think, these guys, I think we need to get,
Alright, I just-
once you guys are done with that, or any time, let's get the gates locked on it. The barbed wire gates, just keep people from going up there without, cause there's a lot of value up there. And I think that might be a place to go out.
We can do that.
And I'd say maybe just, there's 2 gates on the south side, one down by the pond, one on the road.
Okay.
And if you get a link of chain, 2 light padlocks, just till we get it moved or whatever. I think that might be okay. You can do that.
We're talking about the Bailey place.
It's about locking 2 associations, it's the ballpark gates. Just keep vehicle traffic out there.
There's two gates there.
Yeah.
The one on the main and then one to the
Down
west.
by the pond.
Right.
Okay.
Sorry, I was looking at subdivision plats, trying to figure out a road, street closure.
How many minutes do you need?
15 minutes. Executive session for the board, myself and Wade, for non-elected personnel and disciplinary.
So we're going disciplinary action, or just disciplinary reasons?
Yeah.
I say disciplinary reasons. Okay, I would entertain a motion to enter into a 15-minute executive session to include each of the commissioners, Road and Bridge Superintendent Ryan Durst, County Councilor Wade Bowie II, to discuss personnel matters of non-elected personnel regarding disciplinary reasons under the Kansas Open Meetings Act, KSA 75-4319B1, to resume in the County Commission chambers at 11:57.
I'll make that motion.
I'll second it.
Motion seconded by Parker. Any discussion? All in favor, say aye.
Aye.
Any opposed? Passes 3-0. Whoops. Okay, we are back in open session. No action taken following that executive session. Angie has I know we've got some other stuff we're gonna do here, but we have, 2 proclamations here that we could approve real quick.
Well, one of them's probably okay. It's the one that says, wait a minute. What's going on here?
Those say the same thing.
Is it the same thing?
Yeah.
Oh, well. We give you,
So Burlington High School boys and Lebo High School boys have distinguished themselves from qualifying for state tournaments. And then Burlington boys are Class 3A sub-state champions, and Lebo are 1A Division 2, and should be recognized. So this is what Daniel was asking if you guys could do.
no.
I crossed that out, I shouldn't have. So this one should say this week being Burlington High School Boys Week and Lebo High School Boys Week, if that's what you wanna do.
Well, we can go ahead and continue what we're doing here if you wanna
Okay,
get a new copy or copy.
Okay, here. This is one. That one, I think that one's good.
Okay.
Just county schools?
Huh?
Just county schools? Yes. Yes.
I can read this real quick. It's a proclamation. It says, comes now, the Board of County Commissioners, Coffee County, Kansas, and hereby proclaims as follows. Whereas the citizens of Coffee County are served by several fine schools located in each of the communities throughout Coffee County, and whereas each of these schools maintain team sports programs as an integral component of fulfilling their educational mission to prepare their students for a productive and meaningful life. And whereas the team sports programs bind and energize their respective communities and add to the quality of life enjoyed by the citizens of Coffee County. And whereas the players and coaches of the Burlington High School boys and Lebo High School boys have distinguished themselves upon qualifying for state tournaments. Whereas the Burlington High School boys are Class 3A sub-state champions and Lebo High School boys are Class 1A Division 2 sub-state champions. It should be recognized and congratulated for their accomplishments. Now therefore, the Board of County Commissioners, Coffee County, Kansas, on behalf of the citizens of Coffee County, hereby congratulate the players and coaches and proclaims the week of March 9th, 2026 through March 13th, 2026, excuse me, as Burlington High School Boys Week and Lebo High School Boys Week, dated this 9th day of March 2026. That's how it reads.
I think that one's okay. The second one here, I'm not sure how we wanna do it.
Is it different?
It is different.
Yeah.
I don't know if we wanna say,
Oh, okay, gotcha. So,
You need a motion on that.
yeah, do we want to go ahead and make a motion to
I've
approve
got
this
that one
proclamation?
ready.
I'd entertain a motion to approve the proclamation proclaiming March 9th through 13th, 2026 as Burlington High School Boys Week and Lebo High School Boys Week throughout Coffee County. I'll move.
I'll second it.
So, Peters moved, Parker seconded. Any discussion? All in favor, say aye.
I'll
Aye.
get one.
Opposed, that passes 3-0.
Yeah. Help me modify the other one.
And this other one reads, proclamation comes now, the Board of County Commissioners, Coffee County, Kansas, and hereby proclaims as follows. Whereas the citizens of Coffee County are served by several fine schools located in each of the communities throughout Coffee County, and whereas each of these schools maintain team sports programs as an integral component of fulfilling their educational mission to prepare their students for productive and meaningful life, and whereas the team sports programs bind and energize their respective communities and add to the quality of life enjoyed by the citizens of Coffee County, and whereas the players and coaches of the Burlington High School girls, Lebo girls, Waverly boys and girls, and Hartford boys have distinguished themselves, having finished as sub-state runners-up. No, Hartford's not in Coffee County. So just remove Hartford. Okay. have distinguished themselves having finished as sub-state runners-up. Whereas the players and coaches of Southern Coffee County boys and girls should be, remove Hartford girls, should be recognized and congratulated for their accomplishments this season. Now therefore, the Board of County Commissioners, Coffee County, Kansas, on behalf of the citizens of Coffee County, hereby congratulate the players and coaches and proclaims the week of March 9th, 2026 through March 13th, 2026.
I didn't know what to proclaim it as in this case.
Oh.
So that's why
Is that something we normally do?
usually
Well,
you guys do
we
a
just do the-
proclamation when they're champions.
When they're champions,
Like
they
when
don't
they
normally
win
do this
state.
part. I mean, I don't have a
I
issue
don't
with it,
think
but
Waverly boys were sub-state runners-up.
no, they weren't.
Yeah.
I'm not sure that we really need.
I don't think we need this part.
I don't either.
Let's just do the first one we did.
It's always been done before as champions.
Yeah, and it just puts an emphasis on that.
Okay. I'll get that, other one printed, and I'll have you sign it.
Okay, then we're gonna go ahead and move on real quick. Wade, we already did round table, now we're down to you. So,
We just assumed you got several, right?
Here's this one to sign, that's the other one. And we will.
So we have a couple things going on, well, more than a couple, several things going on in the background. Two things I'm working on right now that I'll just bring to your attention. There's a request to close a street over near the Reamers Point area, and I'm sort of mechanically going through the background. I was over in the Register of Deeds office. I had to have access to the plat of the subdivision, because I need to make sure whether it fits a road or a street. And then the second layer of that is notification to certain parties that may include the city of New Strong, because I'm not sure whether that subdivision is a part of their extraterritorial area where they would have the right to.
I believe it is.
You believe it is?
Yeah.
That's, I asked Heidi, she didn't know, so that was gonna be my next step before I have a proposed notice already put together, but I wanted to make sure I knew that, so notice could go out properly. And then if that is the case, then they're entitled to have notice, and then they can provide their input one way or another if they so choose at the public hearing. So
This one?
For Rodney Street.
Yeah.
Yes.
Yes. Yep, so actually I already have that ready to go, but that's what I was sort of working on in the background, and then Ryan happened to come over and we just need to make sure our legal description is right, because so second part of that is there's also a request to close a road at Oxon and between 9th and 8th, is that right? To do that, you need to consider who you want your road viewers to be, and you need to select 3 disinterested householders of the county to serve as road viewers. And then, once that occurs, a resolution goes out appointing those road viewers, and then you set a date for the hearing, and then the board and those road viewers go out and with the surveyor, and you look at the road, and then you make a decision as the road viewers and as the Board of County Commissioners. One, you can talk about, consider damages, you look at whether there's objections, whether or not, whether people are in agreement, and ultimately you then decide on whether that road should be vacated or closed. So, but step one, I know there's been a number of different people in the past. I happen to have one in front of me right now where Tinside, Jean Marion, Lowell Platte, were Lowell Platte were road viewers. Obviously, I know one of them's not in the area anymore, but you guys get to make that decision on who those 3 people would be. I just ask you to think about that. We need to reach out, see if they're willing to do it, and then you need to then come up with a date and time for the hearing. In the past, there's been basically they take county vehicles, go to the area, you provide lunch, then you come back and you have the hearing.
Have we talked about this place on Oxon before, down there 8th and 9th? It came up one time.
I think this request was made, but we needed the legal description. Now we've got the legal description, so this is the next step before we move forward.
This would have been discussed around the first of the year when they filled the application out to request it being closed.
Talking about last year, 2025?
I know, like at the very end of December or in January of this year.
So what do we need to do at this moment?
At this moment, whoever you want to be your 3 disinterested road viewers that will be a part of this process. So if you have names of people who you think would be good for that role and would be interested, you want to reach out to somebody that you know. It just has to be.
And these are non-county commissioners?
Non-county commissioners.
We've tried, and we've been through some other road closings, and I don't know what's different. We've done this since I've been on the board with road closings.
So the last one we did was a street closing, and the street closing out of Jacobs Creek didn't require, because it's a different process.
We tried to do one over by.
We did one, but the land, there's the same landowner on the same.
But we did one that we tried to, over there off of, Old Highway 50 and just to the, east of the vet clinic. That were.
Oh, right.
Yeah, and we never had anything like this going on for that road. And we did that all with the commission.
But that one didn't close.
That didn't
close.
And I don't, from what I remember, we discussed about this road, we weren't gonna close.
I know this one, there's a number of landowners that are affected. Yeah.
This is the first one like this that I can recall that I've dealt with where it's going through this particular process. Usually there's been the balance between a street, and the street was the Jacobs Creek one that went through with the Scouts.
Because the 3 that you mentioned, Cy, Mary, and Platt, that would have been several years ago.
That was several years ago. There's several that have been done over the years. That's just one that I haven't brought with me.
I don't know.
Is this somebody we need to contact ahead of time and see if they agree?
Yeah, they need to agree to do it, and I mean, their names would be in the paperwork, they'd have to sign.
So we don't have to do it right now, we can find them and then maybe approve them next week.
They just need to be citizens of the county that are willing to serve in that role.
That are
disinterested, so you probably don't want somebody from that particular area, would be my position, but.
Okay.
And then once we have those names, then we can initiate and start that process.
Okay, we'll work on that first.
You need to sign another one of these, certificate to go to both schools.
Oh, yeah, we can.
You can mail it out.
Sure. Let me
Yeah.
get,
Go ahead and think about that.
do you want me to put it on heavier paper to mail it?
Yeah, you can do that while we're in there. If we
Okay.
can put it on something that's nice and send it as a proclamation, they can put in their trophy cases if they wish.
Next thing, I received a second application for property tax relief, the disaster declaration, if you recall, I mentioned last week or the week before, similar to what happened at some point last year where somebody's house burns down because of a fire or significantly damaged. Statute allows for them to request relief from their taxes. They just have to provide some documentation regarding the loss and whether it was completely destroyed or partially destroyed. So there's one moving through the process right now. When they come in, and Andrew just handed me a copy of one that was provided to me and I'm working on, but it has to go through the appraiser's office. They have to do their analysis, which takes them a little bit of time, but they have to prorate and either show that there's an abatement or a credit, and then it gets brought back to you. For example, this one ties to the Waverly property and a complete loss due to fire. Steve probably knows which one I'm talking about. So
In January.
Yep.
Yep.
So that'll be coming soon. So I just want you to know, I'm aware of it. They're working behind the scenes. I just need the right documentation and paperwork. So then when it's brought to you and you make a decision one way or another, you have all the documentation you need should somebody want to challenge it. So is that it? And then the last thing, and I need Ryan to be a part of this, is an executive session under attorney-client, and it involves potential litigation involving the county regarding a county right-of-way dispute. Is that a fair way of putting that?
Is that the, is that what was in correspondence earlier?
It ties into that.
That's new interest, okay.
Those look
nice.
Thank you.
Yeah, they do.
Let me fix this real quick.
How many minutes did you say, or did you?
I didn't.
Okay.
10?
We did 15 last time and we were essentially done in 10, but.
Yeah.
So we'll need 15, then I'm going for 10.
If we go in for 10 and we need more, can ask for more.
How about 12?
I saw somewhere where they were doing 7-minute executive sessions.
That's good.
Might have been in our notes.
Did you,
Oh.
is there a motion there, Sonny?
Never mind, I'm wrong.
Okay.
I'm in Word, not.
I say, wait a minute, something's wrong with mine.
Yeah, I didn't see anything.
Sorry about that, oh my gosh. I'm sitting there just.
Oh, there we go.
Let me hold it for ya. Oh, come back.
Okay.
Here we go.
There you go.
This is
Sorry
regarding,
about that.
regarding potential litigation on, regarding a county right-of-way dispute.
Yep.
Okay, I would entertain a motion to enter into executive session, a 12-minute executive session, to include each of the commissioners, Road and Bridge Superintendent Ryan Durst, and County Councilor Wade Bowie II, to discuss matters deemed privileged in the attorney-client relationship regarding potential litigation regarding a county right-of-way dispute under the Kansas Open Meetings Act, KSA 75-4319B2, to resume in the county commission chambers at 12:20 or 12:32.
I'll make that motion.
I'll second it. McCurry moved, Parker seconded. Any discussion? All in favor, say aye. Aye. Passes 3-0. Okay. 12:32. Oh, yes, perfect timing. We're back in open session. No action taken following that executive session. Do you have anything else for us, Wade?
Last thing, I was contacted by one of the board members of PMP Shield this morning before I actually made it over here. And they wanted the board to be aware that they have a meeting on
Monday, next week?
Nope. This week on Friday.
Oh.
Thursday or Friday, now they're running together. I thought I was gonna remember it exactly, but, pretty sure it's Thursday, and, Derek Schmidt's gonna be.
Wednesday, it's Wednesday.
Wednesday?
Yeah, I talked to Rowdy.
Okay. He wanted the board to be aware, and if a commissioner wanted to, be there, he thought since, Derek Schmidt was gonna be here, that it might be good to have somebody from the board there as well, and just to keep the county advised if something like that's gonna happen. I think it's a tour.
Yeah, and at the moment, I believe I don't know if I'll be back from Topeka at the time that he's gonna be there or not. I was going to go with Junie up to Topeka.
Oh, okay.
Apparently they've been partnering, and Derek Schmidt's been working on helping them with something, and he's gonna be in town.
I'll check, and if I can't make it, I'll see if I can get a hold, or either of you available.
I can't, with everything.
Wednesday I could.
I mean,
Or if I haven't dropped, or,
yeah, if I have, I mean, I can check with Mike or Wade.
and that's fine, or, oh, what time?
Like to, I wrote it down somewhere.
2:15 or something like that.
If you can, I can,
2:25.
or whoever you call.
Okay.
Outside of that, that's all I have for today.
All right. I don't have anything else. Okay. Well, that's a wrap for today, I guess. So we will adjourn at 12:34. Need to find 3